Hello everyone, and welcome back to the channel. Today we're diving into a topic that's incredibly important for our long-term health, but often overlooked. We're going to talk about our legs. That's right, our legs can sometimes give us early clues about what's happening inside our bodies, including potential signs of serious conditions like cancer. Now, before we start, it's crucial to remember that this video is for educational purposes. I'm not a doctor, and this information is not a substitute for professional medical advice. If you have any concerns about your health, please see a healthcare professional. The goal here is to be informed and proactive, not to cause worry. So, let's learn together about some of the warning signs in your legs that you should never ignore. One of the most discussed signs is swelling in one or both legs, medically known as peripheral edema. While many things can cause swelling, like sitting for too long, a high-salt diet, or minor injuries, persistent, unexplained swelling is different. When swelling occurs in just one leg, without an obvious reason, it could be a sign of a blockage. This blockage might be caused by a blood clot, a condition known as Deep Vein Thrombosis, or DVT. The connection to cancer here is that certain cancers can increase the risk of developing blood clots. Cancers of the pancreas, stomach, lung, and brain are sometimes associated with a higher risk of DVT. Additionally, some cancer treatments can also increase this risk. So if you notice one leg is significantly more swollen than the other, especially if it's accompanied by pain, warmth, or a reddish discoloration, it's a signal to get it checked out promptly. Don't just dismiss it as something that will go away on its own. Another sign to be aware of is persistent pain. We all get aches and pains in our legs from time to time, right? Maybe you overdid it at the gym or stood on your feet all day. That's normal. But we're talking about a different kind of pain. This is a deep, dull ache that doesn't go away with rest, or pain that wakes you up at night. This type of bone pain could be a symptom of primary bone cancer, like osteosarcoma, although this is quite rare. More commonly, it could be a sign of metastatic cancer, which is when cancer from another part of the body, like the prostate, breast, or lung, has spread to the bones in the leg. This is why unexplained, persistent bone pain in the femur, your thigh bone, or tibia, your shin bone, should always be investigated by a doctor. It's not about panicking over every ache, but about recognizing what's not normal for your body and seeking answers. Now let's talk about something you can see: changes on your skin. Our legs have a lot of skin, and it's important to keep an eye on it. Be on the lookout for new moles or changes in existing ones. We use the ABCDE rule for this. AA is for asymmetry. One half of the mole doesn't match the other. B is for border. The edges are irregular, ragged, or blurred. C is for color. The color is not the same all over and may include shades of brown, black, pink, red, or even white. D is for diameter. The spot is larger than about 6 millimeters across, roughly the size of a pencil eraser. And E is for evolving. The mole is changing in size, shape, or color. Melanoma, the most serious type of skin cancer, can appear anywhere, including on your legs. In fact, for women, the legs are one of the most common sites for melanoma. So make it a habit to regularly check the skin on your legs, even the bottoms of your feet and between your toes. Also, look out for sores or ulcers that don't heal. A wound that stays open for several weeks could be a sign of certain types of skin cancer, like basal cell or squamous cell carcinoma. Have you ever experienced cramps or a feeling of heaviness in your legs, especially when you walk, that gets better with rest? This is a classic symptom of a condition called Peripheral Artery Disease, or PAD. PAD happens when the arteries that supply blood to your limbs become narrowed by a buildup of plaque. While PAD itself isn't cancer, it shares many of the same risk factors like smoking and diabetes. More importantly, symptoms of PAD can sometimes mimic symptoms of other issues. For instance, a tumor pressing on a blood vessel or nerve could potentially cause similar cramping or weakness. The key takeaway is that any new persistent difficulty with walking, a feeling of fatigue or heaviness in your leg muscles that goes away with rest, should be evaluated. Your doctor can perform simple tests to check the circulation in your legs and figure out what is causing the problem. Ignoring it can lead to more serious complications down the line, so it's always better to know. Another sign, which can be a bit more subtle, is the appearance of a lump or mass in your leg. Most lumps we find are benign, like cysts or lipomas, which are harmless fatty growths. However, any new lump that you can feel under the skin should be examined by a doctor. A cancerous lump, known as a soft tissue sarcoma, can develop in the muscles, fat, nerves, or other soft tissues of the leg. These tumors might be painless at first, which is why they can be easy to ignore. They might just feel like a firm, deep knot in the muscle. If you discover a new lump, pay attention to whether it's growing in size. A lump that is getting progressively larger over weeks or months is a significant red flag. Don't fall into the trap of thinking, if it doesn't hurt, it must be fine. When it comes to unexplained lumps, the only safe approach is to have a medical professional take a look. Let's also touch on something called paraneoplastic syndromes. This is a fascinating but complex area where a cancer can cause unusual symptoms in parts of the body far away from the tumor itself. The cancer releases substances that affect other systems, like the nervous system. In the legs, this could manifest as weakness, loss of sensation, or difficulty with balance and coordination. For example, a condition called Lambert-Eaton myasthenic syndrome, which causes muscle weakness in the hips and thighs, is strongly associated with small cell lung cancer. Patients might find it difficult to stand up from a chair or climb stairs. Another example is peripheral neuropathy, which is damage to the peripheral nerves. This can cause numbness, tingling, or a pins and needles sensation in the feet and legs. While diabetes is a very common cause of neuropathy, certain cancers like multiple myeloma can also trigger it. These symptoms can be puzzling and are often the first sign that something is wrong, even before the cancer itself is diagnosed. Finally, let's consider unexplained weight loss and fatigue. These are very general symptoms, but they are often part of the bigger picture. If you're losing weight without trying and you're feeling a level of exhaustion that doesn't improve with rest, it's a systemic sign that your body is fighting something. When you pair these general symptoms with a more specific sign in your legs, like persistent pain, swelling, or a strange lump, it strengthens the case for seeing a doctor right away. The body often works in concert, and a problem in one area can have ripple effects. Think of it as your body's alarm system. Fatigue and weight loss are like the main siren, and a symptom in your leg might be the specific flashing light telling you where to look. Always listen to that alarm. To wrap this all up, the key message here is awareness. It's about getting to know your own body and being able to recognize when something has changed. Persistent swelling in one leg, deep bone pain that doesn't go away, new or changing skin spots, a growing lump, or unexplained weakness are all important signals. Remember, the presence of one of these signs is not a cancer diagnosis. There are many other, more common explanations for all of them, but they are your body's way of telling you to pay attention and seek professional medical advice. Early detection is one of the most powerful tools we have in modern medicine, and it starts with you. Don't be afraid to ask questions and get things checked out. Your health is your greatest asset. Thank you so much for joining me today for this important discussion. I hope you found it informative and empowering. If you did, please give this video a thumbs up and consider subscribing to the channel for more health and wellness content. And please, share this video with the people you care about. Spreading knowledge can make a real difference. Stay safe, stay aware, and we'll see you in the next video.